Welcome back, students. It's your instructor, Kathy Spahn. I hope you can understand me all right. I've got a terrible cold right now, so I hope that doesn't get in the way of understanding the voice narration in this PowerPoint. Our focus this week will be on number style. It's the beginning of Chapter 5. We'll finish up the rest of Chapter 5 next week, but we're going to concentrate on the rules of when do we use numbers, when do we spell them out, and this is an area where it might be a little bit different than what you've been taught before, because much documentation in medical records is in the form of numbers. We have very specific rules, and it's important to pay attention to them. So let's get started with our number style. Before we get started, I'd like to point out on page 227 of your book of style, if you'd pause this for a second, turn to page 227. This is Chapter 10 of the book of style, and it begins with all of the number rules here. This is a very important chapter to make sure you look at in the AHCI book of style. And I do just want to go through the introduction paragraph here because it is so important. And you'll have your book out so you can go ahead and follow along with me. At the heart of patient encounter documentation is the quantifying information that enables the healthcare team to diagnose, treat, and manage patients. There is arguably no more critical information recorded and relied upon than the numeric values that represent a wide variety of indicators for both cause and effect in managing disease. Whether it is the patient's age, vital signs, duration of symptoms, wound measurements, laboratory values, drug dosages, length of stay, indication of pain, or classification of disease, numbers are a critical part of the patient record. They need to be communicated clearly and accurately in all areas of the report, and they represent an area of tremendous potential error in the record. Looking further down on that page, 10.1, numerals or figures stand out from the surrounding text and serve a functional purpose in medical records where they should be used almost exclusively as opposed to spelled out numbers. So what that means that for the most part, we are always going to use a number or a figure instead of spelling out words or spelling out numbers in a medical record. Now this is where it's going to be different from your proofreading and editing classes. Proofreading and editing really focuses on business writing in the non-medical area. So just to realize that's the difference there. You know, you're going to learn in proofreading and editing to spell out numbers 1 through 10. Here, if we're in the medical record and we're doing medical documentation, we are going to always use figures, just as an example there. Further on in that paragraph, it does say, however, that you may have a provider who is very formal in their letters, even in medical letters and medical correspondence, and they may ask you to revert to those rules that you're learning in proofreading and editing. So it's going to depend on who your employer is and what type of information you're transcribing. But let's talk further about our number rules, and again, keeping in mind that we are talking about medical documentation and that more than likely we are going to use figures instead of spelling out numbers. Throughout this PowerPoint presentation, I will have a few areas where I will ask you to type out a sentence. I'll phonetically give you what a sentence might sound like, and you think about it, and how would you transcribe that? And so you would do this in Word, so you could stop our presentation here or after the voice narration is done, and you could minimize the screen, open up Word, and type out the sentence, just to kind of pre-test yourself. Then we'll look at what is the correct way to transcribe that sentence, and then what are the rules for that. So that's how we're going to move forward with our presentation today. And here is our first You Type It sentence. How would you transcribe this? The capsules cost $1 each if purchased after March 31st. If you'd like to minimize the presentation, open Word and transcribe that. See if you get it right. And what we're looking at is mostly the numbers here. So if you just want to think about the numbers or transcribe the numbers of $1 and March 31st, that might be an abbreviated way to do that. And here's the correct way to transcribe that sentence. The capsules cost $1 if purchased after March 31st. $1 is an even dollar amount. It's just the $1, no decimal point 00. We would not spell it out, $1. March 31st, it sounds like the ST, that's an ordinal number, but because the 31 comes after the month, there is no ST on it. If it was the 31st of March, then we would put 31ST. We're going to learn this rule later on in our presentation today. Let's move on. Here's our next one. 20 medical transcriptionists attended the 8 a.m. program on stem cell research. Notice that phonetic spelling there, AM. You're going to see some of this throughout our chapter this week, as well as the worksheet and in our quiz this week. So you'll get a chance to preview some of those ahead of time here. So 20 medical transcriptionists attended the 8 a.m. program on stem cell research. How would you type that up? If you'd like to go back to your Word document and give it a try, do that and come back to our presentation. And here's the correct style for this one. 20 medical transcriptionists attended the 8 a.m. program on stem cell research. Here, because 20 is at the beginning of the sentence, we do need to spell it out. 8 a.m., same thing here as the dollar amount. It's an even clock hour, no :00. And we would not do 8 spelled out a.m., or we would not do o'clock spelled out here. We're going to talk about these rules also. So for Chapter 5, we're mainly going to be talking about how do we transcribe numbers and what is the correct rules for it. The rules are fairly well developed and pretty consistent throughout the area. So we'll learn some rules specifically through the Book of Style and learn how to transcribe correctly with our numbers. As I mentioned earlier, a lot of medical information is expressed in numerical form, such as blood pressure, pulse, temperature, otherwise known as all of our vital signs, patient's age, patient's height and weight, visual acuity, lab work, drug dosages, all sorts of things are done in numbers. So that's why it's very important to learn our rules. Again, the Book of Style says that we prefer to use figures in medical documentation because they're easier to comprehend. It's much more clear, gives a sense of clarity in whatever is being dictated in the record. So we're going to use figures for the most part. Here's our next you type it sentence. We requested 11 14-gauge syringes at 3 in the afternoon for the 16 patients on the first floor. Lots of numbers going on there. Type it up and see what you think. And here's how we would correctly transcribe that sentence. We requested 11 14-gauge syringes at 3 in the afternoon for the 16 patients on the first floor. A couple of choices here. Because 11 and 14 are right next to each other, they're neighboring numbers, we do have to spell out the first number and follow the second number in figures. For 3 in the afternoon, I actually prefer the second one because I think it's a little more clear, 3 p.m. But you could put 3 and then spell out in the afternoon. But again, I think the 3 p.m. makes it a little more clear. Here's our next you type it sentence. We provided 13 1-inch diameter hoses at 8 a.m. for the 19 dialysis machines on the third floor. Same kind of sentence here. Lots of numbers going on. What do you think? Give it a shot and go to the next screen. And here's the correct transcription of that sentence. We provided 13 1-inch diameter hoses at 8 a.m. for the 19 dialysis machines on the third floor. So again, we have our neighboring numbers here, 13 and 1-inch diameter hoses. Since those numbers are right next to each other, we spell out the first one. The second one is a figure, no matter what, how big that number is. And then 8 a.m. is an even clock hour, no colon 00. Third is an ordinal. We're in a medical record, so we are going to do the figure 3 in RD. As far as some vocabulary that you might encounter here during our lesson on numbers, we use numerals and figures to mean the same thing, and that's just the symbols used to express numbers. Arabic numbers might sound like they're some fancy numbers, but they're really just the numbers that we're used to, our figures that we're used to writing down. 1, 2, 3, 25, 27, 103, just regular numbers, figures that we're used to writing out. Those are called Arabic numbers. And then Roman numerals, most people are pretty familiar with Roman numerals, such as the examples given here. They can be either written as uppercase in all caps or lowercase, like in prescriptions. You might see some lowercase Roman numerals. For the most part, though, they are often in all caps. Go back to Word and try to type these out. Type the Roman numeral for number 38. And what's the Roman numeral for 86? How about 1,000? Go out to Word and type those up in Roman numerals. The next slide will show you the answers there. But you should be able to write Roman numerals at least from 1 to 20 or so. And a table that would show the conversion from Arabic to Roman numerals would be a great addition for your information station. Remember that 3-ring binder? I hope you've got those going. That was in I believe our second week of class. I had you go out and get your supplies for that information station. I've actually attached a reference sheet with a conversion from Arabic to Roman numerals. That can be found in the assignments link in Blackboard for this week's assignments. So make sure you print that out, give it a 3-hole punch, put it in your information stations because you might need it in the future. Go to the next slide and I'll give you the answers for how you type out the Roman numerals for 38, 86, and 1,000. And this slide just shows you how to write 38, 86, and 1,000 using Roman numerals. Roman numerals are non-counting numbers, and the Book of Style, page 228 and 229, does have a list of the most commonly used terms for which we use Roman numerals. And it should be noted that this has changed a lot in the past, and most organizations have kind of gone from using Roman numerals to using regular Arabic numbers just for clarity and readability. So just to be aware of that, this is an area where we're seeing less and less Roman numerals, but several things still really do use Roman numerals. And it's going to depend also if you have a very traditional organization that you work for, you'll see more Roman numerals. The use of numbers is used for our obstetric history when we're taking a history on a female patient. And this is just a set of numbers that shows pregnancy and delivery statistics, such as gravida, para, abortus, GPA, and could be dictated any of those ways. Gravida means how many times a woman has been pregnant. Para means how many births of live offspring the woman has had. And then abortus refers to the number of abortions or miscarriages that a woman has had. Here again, our Book of Style does say that we're going to use Arabic numbers, not Roman numerals. Traditionally, we used to use Roman numerals for this, and this is one area where they've gone totally to Arabic numbers. Because and here's our next, you type it. I've got 2 sentences here. The first one is, the patient is here for her 4th visit in 3 days. The next one, a copay of $5 is due at the time of the appointment. Go to Word, type these up, and see how you would transcribe the numbers. And here are the answers. The patient is here for her 4th visit in 3 days. 4th, it's an ordinal, 3 days. Just the number 3. Again, we're in medical reports, medical correspondence, we're going to use numbers. Even though 3 is under 10, which is what you might have learned in proofreading and editing, and again, that's great for regular business correspondence, but in medical reports, we're going to use numbers. The copay is of $5 is due at the time of the appointment. Here it's an even dollar amount, just the $sign number 5, no decimal 00. Cardinal numbers give quantity to objects. Might be a whole number, a fraction, or a combination, such as $15, $sign 15, 3/4 teaspoon, 3/4 teaspoon, and again, no spaces in there at all. 3.5 days, 3-1/2. Ordinal numbers express position, sequence, or order. First, second, third, and so on. And in your proofreading and editing, you're probably taught that you type them out as words in general correspondence, which is fine. Again, in medical correspondence, we're going to use numbers, such as the bottom line here. First, second, third, fourth, 13th, 15th. You get the idea. Here are a few times where we will be writing them out. If we're in like a letter situation and we're talking about the name of a street, such as the clinic is on 4th Street, streets under 10 would be written out, even in medical correspondence, because we're talking about the name of a street. With a numbered street higher than 10, we would use numbers, such as 1240 South 54th Street. Use numbers there. Here's our next you type it sentence. On the 22nd of August, the patient broke her 3rd rib. And here's the correct way to transcribe that. On the 22nd of August, the patient broke her 3rd rib. So here we're using these ordinals again. When we have the date of a month that precedes it with an ordinal number, such as this, 22nd of August, we can do the 22ND. If it was on August 22nd, the patient broke her 3rd rib, we would not use the ordinal ND on there. It would just be August 22. Okay? But because it comes before the month, we're going to go ahead and use that ordinal, that ND on there. And then broke her 3rd rib. Again, even though it's under 10, we're going to use a figure in this case because we're in medical correspondence. And the slide just reiterates what we just learned here. In medical reports, we're going to use figures for our ordinal numbers with dates before the name of the month, such as the 26th of September, 26th. But if it was September 26th, no TH. Sentences that begin with a number, we really want to try to rewrite that sentence if we can, because it's not great to start a sentence with a number, such as 12th grade students in the honors program are simultaneously enrolled in technical college courses. How do you think you would reword this sentence? Go to the next slide and we'll take a look. And here are a few examples of how we might rewrite that sentence to avoid starting it with a number. Regarding whole numbers, in medical records and correspondence, we're going to use figures, such as he recovered 2 years ago. She spent 7 days in the ICU. There were 3 accident victims. So you can see how this works, and again, might be a little bit different rules in your general business writing, the Gregg reference rules that are for our regular business writing, other than our medical records writing. Here's our next you type it sentence. The new medical facility will cost millions of dollars. How are you going to transcribe that? Go to the next slide and find out. And this sentence is transcribed exactly how it sounds there. Millions, because we don't know exactly how many, we don't have a specific number, we're going to just spell out millions. And no $sign here. We're going to spell out indefinite numeric expressions in words. Hundreds, thousands, several hundred, several dozen, mid-30s, late 50s. You get the idea. If we don't know exactly how much, we're going to spell it out in numbers. Regarding fractions as numbers, we're going to use a whole number for the numerator, the slash mark, and then a whole number for the denominator, no spaces, all together. Mixed fractions are where we have a whole number and then a fraction also. If your word processing package does not automatically superscript the fraction that follows it, we need to put a hyphen between it, such as 3-1/2. if you are using Word, it will automatically superscript and make that a smaller fraction so that it's easy to understand that it's 3.5. You'll have to check this out with your word processing package and see. Otherwise, it would look like 31/2. So if our word processing doesn't automatically give us a superscript, we need to put that hyphen there for clarity. And just so you know, many electronic medical records software packages do not use any superscripts for that. So just so you know, you may have to do the number, hyphen, and then the fraction. And also note that if the dictator says 1 1/2, which is how they'll dictate it, you're going to key 1-1/2, not 1 and 1/2. So make sure that that you're not changing what they're saying there. They're dictating a mixed fraction here. And here's just this paragraph here from the Book of Style that talks about these reduced size fractions or these superscript fractions. If you can't do that, we need to put a hyphen between the whole number and the fraction. We are going to spell out fractions used without a whole number or not modifying a noun. So the residue was only 1/3 of the amount versus a 1/3 inch gash was observed. Here's our next U-type sentences. I have 2 of them here. There were 2 3-centimeter ulcers. A cyst was removed at the 1 o'clock position of the left breast. Go to Word, type those up, see what you think. And here are our answers. There were 2 3-centimeter ulcers. We have 2 neighboring numbers. The first one is spelled out, the second one is a figure. A cyst was removed at the 1 o'clock position of the left breast. When we're talking about the face of a clock of a round object, we spell out o'clock. So once again, for neighboring numbers, spell out the first number in words, use a figure for the second. The surgery required 20 4x4 sponges. Notice how that is done there. We haven't done symbols yet, but it would be 4 space lowercase x space 4. Spelling out 20 because it's the first number of adjacent numbers. The patient had 3 2-centimeter nodules. Here we have our 2 adjacent numbers, our neighbors. 3 is spelled out, 2 is a figure. A few specifics about time expressions. Write out even clock hours as a word when written without o'clock or AM or TM. The meeting was called to order at 2. Visitors must leave no later than 9, N-I-N-E. Otherwise, we're going to use figures for all other cases. Many times, dictators may reference a clock face when they're talking about an anatomical area that is round, such as the breast or the eye. Those are the 2 most common. And this is just to kind of pinpoint where in this circular object something is. So such as the breast showed some dimpling at the 2 o'clock position. Everybody can kind of get in their mind where this dimpling is, right? You see the clock, 2 o'clock, you know where it is. So that is transcribed out as the number 2 and then o'clock spelled out. A foreign body was noted at the 10 o'clock position, OD. Talking about the eye here, it's at the 10 o'clock position, so it's very easy to reference that clock face and know where we're talking about, where this foreign body is. What does OD mean? Anybody know? Have you had your language class on ophthalmology yet? OD refers to the right eye. If we have an even clock hour, we're not going to use the colon 00s, such as 7 a.m., just 7, A period, M period, lowercase, no colon 00. We're going to avoid 12 a.m. or 12 p.m. It makes people think too much. We're either going to use 12 noon or just noon, 12 midnight or just midnight. Here's our next U-type sentence. The baby was born at 18:20 hours. What do you think about that one? Think of how you would transcribe that. And here's our answer to this one. The baby was born at 18:20 hours. Obviously, we talk about military time here, which many healthcare organizations do use for documentation. 1820 hours spelled out. And what time is this? What time of the day is this? Think about that a second. It's at 6:20 in the afternoon. And this is why military time is a little more clear, just because once you know the time, it makes it much more clear, and we're not worrying about is that morning or afternoon. So again, many companies do use military time. So here's just a few more examples of military time. If you hear 800 hours, we're going to transcribe 0800, meaning 8 a.m. 1100 hours, 1100, meaning 11 a.m. And 1200 hours would be 1200, means 12 noon. 1400 hours, 1400, means 2 in the afternoon. 1630, 1630, means 4:30 in the afternoon. Military time is written with 4 digits, no colons, and hours should be included if they're dictated, or if it needs it for clarity. You can always add hours. Here's our proofreading to save your butt, just to get off the number rules for a minute. And again, this is a real blooper that I've gotten through some email that I have. Diagnosis, Apache infiltrate. What do you think about that one? What do you think's wrong with that one? Go to the next slide and find out. Diagnosis, Apache infiltrate. P-A-T-C-H-Y. We're not talking about an American Indian Apache. Whatever we transcribe has to make sense, and that is the bottom line. If it doesn't make sense to you, re-listen, look it up, flag it if necessary. Needs to make sense. Here's our next you type it sentence. White count 5,300. How are you going to transcribe that? White count 5300. No commas. I think we talked about this in our comma unit, but remember that we're only going to use a comma with 5 or more digits. So in this case, there's only 4, no comma after the 5. So again, we're going to use a comma to punctuate numbers with 5 or more digits. And then I've got a number of exceptions here in addresses, dates, zip codes, telephone numbers, ID numbers, that sort of thing. We're going to use whatever format is correct, given those types of situations. The CAT scanner is insured for $89,000, $89,000. Note my new zip code, 53705-4007. Again, whatever the correct format is how we're going to do it, just like our area code, which is the last example there. Use whatever format is appropriate. And similar to our even clock hours, even dollar amounts do not require the decimal point and the 00s, such as the prescription cost $123, $123. The aspirin costs $8.79. Here, of course, because we do have an uneven dollar amount, we've got 79 cents, we do need that decimal point 79. The next one here, I lost hundreds of dollars on the phony scheme. Remember, that's an indefinite amount. We don't know exactly how many hundreds is spelled out. UW Hospital and Clinics operates on a $1 billion annual budget. Note here, it's $1 billion spelled out for our large dollar amounts like that. We would not do $1 billion and then dollar spelled out. That's redundant. So just to realize the difference there. In normal sentence text, we are going to spell out months when we're talking about dates, and then use figures for the day and the year when we have it all together here. So like this one, the patient was seen on August 3rd, 2010, and requested to return on September 30th, 2010. We would not put 8-3-10. We would want to spell that out. It's in normal sentence text. So spell out the month. The patient was seen for a fireworks injury on July 4th last year. If something like this is dictated last year or yesterday or when we can figure out exactly when it is, we need to find out the year and insert it. And this slide just shows some examples of writing out dates, figures, and reports, such as office visit 1/11/2011, date of birth 9/29/1917, admission date 6/15/2009. And many organizations are going to the 4-digit year, just so that there is absolutely no room for error as far as, are we talking 19 something or 2010, what are we talking about for years? So many institutions are going to the 4-digit years. Here's our next U-type sentence. The incision was closed with number 30 chromic sutures. The incision was closed with number 30 chromic sutures. We're going to talk a minute about suture material in our next slide here, but notice with number in this situation, we're going to do the number sign 3-0, and it is a 0 on our keyboard, not the letter O. As shown here, our suture material does have very specific numbering with it, and when it's transcribed, we use a number, a hyphen sign, and a 0. And again, 0 on the keyboard, not O, even though it is dictated as an O. And if number is dictated, we're going to use the number sign. And just for your own information, suture sizes range from 7, number 7 as the largest, to number 11 O, 11-0 as the smallest. Stainless steel material is also dictated similarly, where number 40 is the smallest, number 20 is the largest. And our Book of Style does give a really nice description of this in our numbers chapter there too, a little bit more information about suture material. Our next U-type sentence, the incision measured 2.5 by 4 centimeters. How are you going to transcribe that? Go to your Word document, type it up. The incision measured 2.5 by 4 centimeters. And here's the answer to that one. The incision measured 2.5 by 4 centimeters. 2.5 space, lowercase x space, 4 space, cm. We always abbreviate our centimeters and millimeters, all of those metric units of measure when we have a number tied to it, and decimal point only when it's dictated. So again, for figures for dimensions, we're going to leave a space before and after that lowercase x that represents the word by. 9 by 5 by 11. 9 space lowercase x space 5 space lowercase x space 11. And we're only going to transcribe decimal numbers if specifically dictated. 9.5 by 5 by 11. Decimal point's only going to be in that first one there where it was actually dictated 9.5. Regarding numbers that have traditionally had some superscripts or subscripts in them, for the most part, it's perfectly acceptable to go ahead and execute those on the line, such as H2O. Traditionally, that 2 would be a subscript 2, but it's okay to go ahead and put it on the line. Or L4 for the lumbar 4 vertebrae, L4 on the line versus L subscript 4. Either way is fine. Where we might run into some problems would be with our exponents here, though, because if we don't have a superscript with our exponents of 10, it would be confusing, such as 3 squared would look like 32 if we didn't have that subscript. Traditionally, the spinal column numbers used to be subscripts, but more and more we're seeing them right on the line, and that's fine, such as the cervical vertebrae, thoracic vertebrae, lumbar, sacral. So C6 can be right on the line, or subscript 6. L1 to 2, L1-2, or we could subscript the 1-2. And again, it's important to note that many of the electronic healthcare software does not allow for superscripts or subscripts, so we would almost be pretty much forced to do them on the line. And this is just another example of where traditionally we've seen subscript numbers, such as in our ECG, the chest leads, V1 through V6. Traditionally we would do subscripts, but again, more and more we're doing them on the line. It's more efficient and works better with our electronic healthcare software. And ratios were already covered in our punctuation mark unit with the colon, but just a few other formats that you might come across. Dilute solutions, 1:100, 1 to 100. A 50-50 chance of recovery, 50-50, or male-female ratio. We might see the male/female or male-female. So just different ways to do ratios. However, when we are talking about dilute solutions, we always want to use the colon, 1:100. And here's a review from our hyphen unit. We can use figures in the word to or a hyphen in a range, such as tablets will increase somewhere from $1.25 to $1.75. So we can use TO to show that range there. The increase will range from $3 to $4.50. And notice here we use the decimal point 00 for consistency between one and the next number. One example of when we would not want to use a hyphen in a range to replace the word to would be when we're already using positives or negatives as symbols. So the weight change is negative 6.5 pounds to positive 10.5 pounds. So you can see that that hyphen in there just gets very muddled. We kind of lose it. We don't really know what it's saying. Better to do the second example here. The weight change is negative 6.5 pounds to TO, positive 10.5 pounds. So again, when we're using negatives and positives, spell out to. We're going to repeat any symbol or abbreviation in a range. Allow $3 to $4 for postage, $3 hyphen $4. Or we could use TO in between there. We expect 10% to 20% to attend. Repeat that percent sign there. The temperature was between 99 degrees and 101 degrees. We're going to repeat that degree sign. Here's our next you type it. The mass was 1 1/2 centimeters in diameter. And another sentence, the incision was injected with 0.5% xylocaine. How are you going to transcribe those? The mass was 1.5 centimeters in diameter. That's how we're going to transcribe that one. The incision was injected with 0.5% sign xylocaine. Let's look at these a little closer in the next few slides. Mixed numbers are whole numbers with a fraction or a decimal, such as the patient had symptoms for 2.5 years, or 2.5 months. 2-1/2. If you hear 1 1/2 years ago, transcribe 1-1/2. Or again, if we have the word processing software that will automatically give us the reduced size fractions, we just do 1/2 and it would automatically superscript that. If you hear 1.5 centimeters, we're going to transcribe 1.5 centimeters, not 1/2. If you hear 3/4%, transcribe 0.75%. We're not going to use a fraction here. So the main thing to note here is that fractions are not used with the metric system or with the percent sign, so you have to convert them to the decimal equivalents. And when we're transcribing decimals, a 0 is placed before a decimal that does not contain a whole number, so it will not be read as a whole number. And this is to make sure that we don't have any misreading of that. Inject 0.5% xylocaine in the elbow. So we wouldn't want it to mistakenly be read as 5% because that's a whole lot more. So we always want to put that leading 0 before the decimal point if we do not have a whole number in a decimal. Of course, we have one quick exception to this rule. A leading zero is not placed before a gun caliber measurement. The emergency room physician suspected the gunshot wound was caused by a .22 caliber rifle, .22 caliber rifle. So no 0.22 on this one. So what's going on in professional development lately? If you have anything new in the news, any new terms, anything on the radio, anything in the medical community that's got your interest, some new development or anything? I know I ask you this every week, but pay attention and be aware of everything going on around you. We're always looking for new procedures or new breakthroughs, because that will help us in our medical transcription and in our professional careers. So be aware of that. And that's it for our numbers unit this week. Thanks so much for listening, and we will see you next week.